In terms of novel therapies, one of the therapies that has come about recently is something called Emavusertib. It's a new agent that's being studied right now from Curis. It's an IRAK4 inhibitor, as well as inhibiting CLIC1, 2, and 3, and also has some FLT3 inhibition as well in both the tyrosine kinase domain and also the internal tendon duplication domains. Have either of you had any experience with it, and can you just talk about your experience with the drug?
Yes, we have experience with the drug. We used it for relapsed refractory AML patients and for MDS patients. Currently, it's in monotherapy phase still. So most patients tolerate the drug very well. From a response perspective, that has still, we have not, my patients have not yet responded to the drug yet. But again, we're still in the process of finding the correct way of giving the medication, the correct duration of the drug needed. But from a tolerance perspective, it's pretty well tolerated. And hopefully that, given that there is preclinical data showing synergy with venetoclax and with HMAs, as they move it with combinations, we hopefully will be able to see a good efficacy signal in both AML and MDS. I know that from a FLT3 perspective, the data is pretty promising with the agent with FLT3 in the relapsed refractory FLT3 mutated disease. And that's also something which is important because some of these patients responded after HMA venetoclax failure. And I think that's a very important signal to see if we continue to see it, because one of the things that we published on as a multi-center study, and the group at MD Anderson also published on it, once you fail HMA venetoclax, a lot of the targeted drugs don't work well, and survival is pretty truncated to about 3 months on average. So seeing that there is some activity with the drug out in that setting is pretty promising.
Daver?
Yeah, we've had experience as well, clinical experience, more in the MDS arena with that, although we've had a couple of recent AML patients. And I mean, I've definitely reviewed the data, and as have you and Dr. Abaza, and I think the signal in FLT3 is very interesting, and with more time seems to be holding up. And we're seeing somewhere around 35% or so CR, CRi, CR, CRh, small numbers, but these are all patients, as Yasmin was saying, who've had prior ven. Most of them had prior FLT3 inhibitor, and we kind of have data, from our group, from the group at Northwestern, from the group at Yale, all showing that post-HMA ven, the expected response to a targeted therapy, whether it's an IDH inhibitor, FLT3 inhibitor, is not 40%. It's more in the 10 to 20% range, much lower. So in this population, and also considering they've also had a prior FLT3 inhibitor, even with small numbers, this looks encouraging. I think it's a little surprising to me as well, because this drug was positioned more as a MDS splice targeted therapy, and the FLT3 component, I think, was almost like, okay, it's an additional thing, but with more time, it seems like the FLT3 inhibition and maybe the click inhibition, I don't know too much about that biologically, is actually going to play an important role in development. So this is quite exciting. Yeah.
Well, and it's a thought where the inhibition of the spliceosome is where you have this long versus short spliceosome that makes it more susceptible to the IRAK4 inhibition. You're right, there's definitely activity there, but the FLT3 seems to have overtaken that part of the activity. And what's interesting is that it seems to be affecting patients that have FLT3 mutations that have already seen a FLT3 inhibitor, and generally that have already seen gilteritinib. And so the question then becomes, what's different about this? Is it the combination of the FLT3 inhibitor with IRAK4? Is it the fact that this drug also inhibits NF-kappa B downstream, and so you're blocking sort of one of the resistance pathways? I think these are all very important things that need to be determined and need to be figured out with larger trials. But I do agree with you. It's a promising compound that I think is going to be giving a little bit more, we will be giving more attention to it.